An abortion is a way to end a pregnancy. Another name for this procedure is pregnancy termination. There are many reasons why a woman might have an abortion. She might not be able to afford a baby, not have room in her life for a baby, be single and not want to raise a baby alone, have problems with her husband or partner, find out that something is wrong with her unborn baby, have health problems that make pregnancy a problem. This is a very personal decision. If you don't know what to do, talk to someone you trust. Your doctor, nurse, or clinic can help. It might also help to talk to your partner, family members, or friends. If you're younger than 18, you might need permission from an adult. There are two main ways to do an abortion. Medication abortion. You take pills to end the pregnancy. This only works until 10 weeks into a pregnancy. That means 10 weeks after your last period. It is also sometimes called medical abortion. Women who have a medication abortion need to take two separate medicines. Surgical abortion. A doctor uses surgical tools to end the pregnancy. This can be done in the first or second trimester. The procedure takes 15 to 30 minutes, but most women spend a few hours at the clinic. At the clinic or doctor's office, you will take a medicine called mifepristone, brand name Mifeprex. A few hours or days later, you will take another medicine. This one is called misoprostol, brand name Cytotec. You can take the second medicine at home. The medicines cause your body to end the pregnancy. It might take 4 to 6 hours after taking the second medicine for this to happen. When it does, you will bleed from your vagina. You might also see blood clots or pieces of tissue. Yes, common symptoms include pain and cramps in the lower belly after you take the second medicine, misoprostol. These last for up to 6 hours. Bleeding from the vagina. Bleeding can be very heavy for a few hours after you take misoprostol. Light bleeding might go on for a few weeks. Fever, nausea, vomiting, and diarrhea. First, you will get a shot of anesthesia, so you will not feel pain. Some kinds of anesthesia allow you to stay awake. Some put you to sleep. After the anesthesia starts working, the doctor will use special tools to remove the pregnancy tissue from your uterus. This is done through your vagina, figure 1, so there will be no cuts or scars. Yes, it is common to have pain and cramping in the lower belly. This lasts for a few hours. Bleeding from the vagina. This is usually lighter than after a medication abortion. The bleeding can last for up to 2 weeks. Women can have an abortion until the legal limit in their area. The legal limit in many places is about 20 to 24 weeks, or until a baby could live outside the womb. Abortions after 14 weeks sometimes involve a longer procedure, but they still involve medicines or surgery or both. Call right away if your bleeding is heavy enough to soak through 1 menstrual pad each hour for at least 2 hours, and you're still bleeding. Your pain is really bad. It makes you double over or makes it hard to move, and you don't feel better with pain medicines, such as ibuprofen, sample brand names, Motrin, Advil. You have a fever higher than 100.4 degrees Fahrenheit, 38 degrees C. Bad smelling discharge comes out of your vagina. In some cases, abortions do not work completely. In other words, they do not always get rid of all the pregnancy tissue. If that happens to you, you will need to have a procedure to remove any leftover tissue. Signs that an abortion was not complete include not bleeding after a medication abortion, still feeling symptoms of pregnancy, such as nausea and tender breasts, 1 week or more after your abortion, bleeding for more than 2 weeks after an abortion, not having a period in the first 6 weeks after an abortion. In general, abortions are very safe, but like any medical procedure, abortions do have some small risks. If you have an abortion, make sure it is done by a doctor or specially trained nurse in a clinic or hospital. Do not take any medicines or put anything in your vagina without talking to a doctor or nurse first. Do not have sex or put anything into your vagina for 2 weeks after an abortion. If you do, you could get a very serious infection. Having an abortion does not make it harder to get pregnant again. Abortions do not harm your health, and they do not harm the health of your future babies.